Welcome, everybody, to the latest edition of Breaking the Silence, the Conversations. We've had a little bit of a break. Everyone's aware I've been in a spot of bother as a consequence to the GMC. So I've just took a little bit of time out of being the interviewer. But we're back today in earnest. We've got some really interesting conversations, both with whistleblowers and with vaccine injured victims. And I say victims, I can't say it any stronger, victims of the system, victims of trust in a profession that really should have given information to people who trusted in them. So with no further ado, I'll become the interviewer again, and I'm welcoming today Dan. Hello,
Hello,
Dan.
thank you
You're
for having
probably,
me.
I don't know if you want me to use your second name or not, so
Yeah, can do,
I'll let
yeah.
you do that. First things first, I want you to introduce yourself. Just a little bit about you, Dan. First, thank you for coming on and speaking. We met about 3 or 4 weeks ago now, is it in Guernsey? And we'll come to that event at the end.
Yeah.
You want to leave on a high, really, but yeah, tell us a little bit about yourself, Dan, and what you did
So
before.
36 years of age, lived in Guernsey, carpenter and joiner, sort of trade. Fairly good lifestyle before, no stress, no worries, fairly happy. I lived in Alderney for 13 years prior, and then moved to Guernsey for my work. And yeah, that's about it really. I think on the front of before everything went sideways.
Yeah, and were you in good health? Just about. I mean, don't give me all your medical history here,
No,
but were you in good
yeah, I was fine. I was at the time, I was up and down scaffolding, pulling concrete up here, there, and everywhere, lifting big sheets of material. I was fit as a fiddle.
Yeah. And so having that previous good health, not really a frequenter to the local surgery in any way, shape, or form. The pandemic, I'll be respectful for now and call it the pandemic, inverted commas, happened. What was your kind of initial reactions to what you were seeing on the screen? Were you getting sort of fear transmitted to you across the TV over in Guernsey, or were you sort of
I'd
just,
say so. I was in Alderney at the time, and it was a very small community. So there's about 2,000 people that live there. And it is very difficult, especially because at the time you're told that if you don't have it, you're going to kill grandma up the road, or that friends and family are going to die if you don't have it. And when you're in such a small, this island's 3 miles by 1 mile, it's a very small, close community, and it's lovely. But when you're then sitting there debating whether you should have it or you shouldn't, there wasn't really a choice.
yeah. I mean, it's very clever, really, what they did. It was like kill your granny, couldn't you? You could kill your granny, firstly, with the disease itself, with asymptomatic carriage and all the rest of it. So they put that sort of fear on people's shoulders. And then suddenly the way out of this and to get back to normality with all the wacky rules that were going on was to take this jab, this safe and effective. It was repeated and repeated. And then put the added kind of blackmail, if you like, that. I remember the Kill Your Granny campaign. It was very effective because people did it for the right reasons. Because let's say that this was a safe and effective intervention. Why wouldn't you? Why wouldn't
Yeah.
you? So you're watching the TV in the evening and we're seeing all these ITUs packed. That's what they were telling us anyway. I've got an alternative to that, but I think people know my views on that. So anyway, so you're weighing up the decision to take it. Take us through that day when you took the first one. What was
So lined up at the surgery, had my first injection. I sat down. There was no paperwork, no leaflet from inside the box, no nothing, no side effects. Just there you go, bang it in the arm, and then sat there for 2 minutes, and then just went off.
So that was it. It was literally
Um,
you're shepherded through a centre, no exchange of information. Do you think, looking back at that exchange, I mean, it seems clear to me, but do you think you got informed consent to what you were having
no.
administered?
Well,
No.
there was no adverse reactions, no side effects. There was no myocarditis, no pericarditis. There was nothing. You just might feel a little bit of pain in the area that it's injected. You might feel a cold or a flu. Other than that, you're good to go.
And it's done at quite speed, isn't it? Do you remember? I don't need to name names here, by the way, but do you remember the person who injected you, or was it just that
Yeah,
rapid? Do
yeah.
you
When I got my vaccination card, so I checked my batch number, and the name was on there. Um,
that name's imprinted on your mind?
yeah.
So yeah, we'll come to that. So what happened after that? Take me through. The floor's yours, really, to run through sort of how many you had, what was the thinking, and sort of how the health changed since.
Um, After the first one, I noticed a dramatic change in how fit I was. I was getting very, very tired, finishing work, having to sleep. A lot of headaches. Still didn't obviously associate anything with them. And then so I had my first injection in the February, I had my second injection in the April. I think about 3 months after that, my lower back exploded. I had no back pain, no nothing. My L5S1 just completely and utterly blew. Um, and then I had to then have an operation for that shortly after. But I'd been in accidents and stuff growing up. I'd been in hospital before, and there's never ever been any issues with my health. And before going into the spine surgery, they'd noticed that I'd had a significant problem with my heart, and they delayed the operation for 3 days. And they sort of said that you need to get this checked out, but I was unaware of what was happening.
There's no family
Um,
history of anything at this point. We didn't touch on that at the start. No heart issues.
yeah, there's
No
been
sort of
no
back
no
disease.
family history of anything really. There's never been any heart disease or any heart problems within the family.
And I'm guessing at this point, no one, yourself or are you starting to think this could have some relationship to the vaccine with the temporal side of it, or are there any medical professionals sort of mooting that potential association at this point? So we're two jabs in, your health has took a turn in two different
Yeah.
ways, really. There, well, three different ways. How you are constitutionally tired all the time, this back issue, and then suddenly picking up the heart issue. So what were they saying about your heart? What were the sort of
This was because obviously I had to be sent to Manchester for an op, and this was picked up in my pre-ops. They then referred me back to my doctor, and nothing was ever done. Um, and that was that really. I'd gone back to work after having spine surgery. I was fine. The tiredness was still there. The dull aches around my body, the nerve pain around my body was still there. But then I thought I've just come out of spine surgery. It could be that. Um, but I was getting very, very tired. It was very strange because it was very mentally draining. This was when I started noticing my mental health was declining rapidly before my physical health. Very depressed, anxious for no apparent reason. I was happy. And then, yeah, and I moved over to Guernsey, and then on June of 2023, I started dropping at work.
So this is just out of the blue. You would just, when you say drop in for everyone at home, really, is that you literally drop in, just drop
Yeah.
attacks, all them with
I
no
had
pain.
very strange symptoms leading up to it. For weeks previous to me dropping, my left arm was going very, very numb. I had electric sensations going from my elbow down to my fingers. I couldn't recognize people. I could pick up. I'd been using a saw for many years. I could pick up a saw and didn't know what it was. My mind, I'd just be standing there, I'd be like, what am I doing here? And then oh, okay, we're back in the room. Yeah, right. And then, yeah, I started dropping at work. And then, yeah, started seeing the doctor from there on. And it was diagnosed at the beginning. I was going unconscious 100 times a week. And yeah, it was diagnosed as sciatica.
How did they come to that clever conclusion? I mean, that's gaslighting already before we've even got into proper gaslighting. But how can it possibly be that you're dropping down? I mean, drop attacks are, as a doctor, there's a plethora of investigations that are required, and many things can do it. It can be neurogenic, it can be cardiogenic, it can be to do with the heart, it can be to do with any part of your body that will lead you to drop, and that's a process that has to be gone through. Did that
Mhm.
process get gone through for you? Were you having scans and investigations? Or did they just default to this really obscure sciatica, which I just can't get my head around when you first told me this?
So they stayed with the sciatica. I was then signed off work. My symptoms then were developing rapidly. I was about 56 symptoms within the space of 3 weeks. So I was having slurred speech. The head pressure was unreal. The pain in my head at the base of my skull was unreal. I couldn't see a great deal. One of my ears I couldn't hear from. My whole left side had completely gone numb. And they were still standing by the sciatica because I've had previous spine surgery before. They linked it to that. But lucky for me, the spine surgeon actually got in contact with me and he said, "This isn't the spine surgery, Dan. This isn't." He said, "I'd love to see you." He said, "I'd like to get you over to Manchester and get you seen." He put in a referral and it got refused.
Very odd. I mean, just from the perspective of doctors, and I very rarely defend them, but when people are coming in, and this is like a new wave of illness coming in. So firstly, you've got all the doctors that have jabbed everything with a pulse. So you've got that on your conscience, and then you've got people returning to the surgery. And what doctors are trained to do is spot patterns. recognizing symptom clusters and say, oh, if you've got that, that, and that, it sounds like a epilepsy, or if you've got that, that, and that, it sounds like it's something to do with the heart. We need to go down that route, or it sounds a bit like MS because you've got these relapsing remitting conditions. But these presentations of vaccine injury are so wildly different that doctors will ultimately start saying, well, this doesn't make sense according to the textbook that we learned from at medical school. This doesn't fit in to our sort of box tick thinking, and that's where the sort of gaslighting begins. But what I never really understand is those, I've heard it time and time again, where people are presented with multi-systemic inflammatory symptoms in various orders, to then be told, there's nothing wrong with them, and very, very minimal tests are being done. You can only say something's not happening if you prove it's not. You
Yeah.
haven't got a brain tumor if you have a CT scan and it hasn't got a tumor in it, etc. But if they're saying sciatica on presentation of things, it just don't sound very neuropathic.
Yeah.
Some of the things were a sprinkling of things, but these drop attacks needed urgent investigation, which never seemingly happened by the stands of it.
No. They diagnosed me. I saw a neurologist for about 4 minutes. It was quite a funny appointment. I wished it was one that I'd recorded. I'd sat down with the neurologist first time seeing him, and I passed out unconscious on his table. I was gone. I had my mother-in-law and my girlfriend present.
Is that the video you put up on Facebook the other day when you
Yeah,
were in the chair and you'd slumped down and he's
and
shaking?
that's what I was like all the time, 100 times a week. I could not, and every time I was coming back out, Dr. Cartland, I couldn't see, I couldn't speak, I didn't know where I was. And this was happening multiple times. It was like trying to reboot a 95 Windows computer every time. Sometimes you might not get speech for about 4 days. You couldn't talk, so I'd have to speak to my partner on a speech app. You might not be able to see. Sometimes your legs just won't work. And yes, I was given the FND diagnosis and left at that.
So this run me through this sort of 4 minutes with a neurologist. So firstly, how long have you waited for this? Because that's what you need when you've got these kind of neurological odd presentation. You need to have a neurologist firstly scan over it, possibly a cardiologist, given they picked up something with your heart as well. 4 drop attacks, you're thinking neurogenic or cardiogenic at that point. No cardio referrals, I presume.
Refused 6 times now.
Your referral into cardiology has been
Yeah.
refused.
Yeah,
Bizarre.
I've seen a neurologist twice, and yeah, he diagnosed me with FND, and said that it's purely psychological. It's probably from some trauma from somewhere, and then they referred me to the local, what I'm going to call as the local nut house, and then I
So
had to
let's
undertake.
pick apart that. So you've had 4 minutes with a neurologist. Firstly, did he ask you many sort of pertinent questions? I mean, what the thing with neurology appointments, first outpatient appointments, it should be an hour to do a full body neurological assessment, to do tone, power, coordination, reflex, sensation of all 4 limbs, as well as doing cranial nerve exam. These are just basics, and you need an hour. Cranial nerve, cerebellar exam takes about half an hour to do it properly. So GPs don't really stand a chance. But the physical exam to go along with the history, there barely was a history taken, was it? And that's really key in neurology. I know enough of neurologists. Examination, did they get you putting your nose, follow the finger? Was there any of that?
Yeah, I got that. I got the hammer. I don't know what that hammer's called, but I hate that thing now. I really don't enjoy that. Um, and he noticed as well there was a lot of signs that there was issues going on. And there was a lot of panic from my partner and her mum as well. They were having to see me and live with me for most of the day like this. And he just said yes, just it's FND and that's that.
It's picking up clinical signs. Is he talking you through? Like he's doing your reflexes and telling you, oh, there's an absent reflex there, or the sensation isn't right there. And then at the end concludes, despite finding hard neurology, as we call it in the trade, hard neurology, then saying functional. I mean, for those who don't know, I don't know if you want to explain it. You may explain it better as you've been stamped with this FND diagnosis. It's so infuriating. It's a default diagnosis when you've done all the battery of tests, every investigation, then you can default to functional. But in your own words, what are they telling you? Functional neurology, as you mentioned, trauma.
Well, functional neurological disorder is, what my understanding is, it's a plethora of symptoms that don't fit into a box. What I always say that it stands for is found no diagnosis.
Yeah.
Um, and the symptoms that I present him with, they should have been investigated. There's a lot of people that I speak to, and we're just given the FND label, and that's that. But we've got red flag symptoms that need to be checked. But we're all just put into this bracket. FND was once known as conversion disorder, um, And yes, but it can happen in patients with severe trauma. But for my reasoning, that she said the trauma was from a family death that had happened in 1992. This was in 2023, and I said, I don't think so. Um, and then the
Well,
other
it's again.
ones was that I'd got it off of TikTok to try and act cool. That I was just imagining it. It was just all in my head. Um, I've had all sorts thrown at me.
I mean, this is it's just outrageous that they're saying it's a psychosomatic thing. You've been in previous good health. You have absolutely no agenda to act in this way, and that's kind of what sometimes when they it's kind of attention-seeking behavior in some cases of genuine FND, and it does exist. It genuinely does
Mm.
exist. People drop down and have pseudo seizures. I used to be an A&E doctor, see it all the time, and then you do a test on them to make sure they couldn't control it if they were genuinely having a seizure, and then they pull away, for example. So there are tests you can do, but it doesn't sound like you've even had the baseline investigations here. And
They
what it
done the MRI of my spine. That came up with spinal stenosis, but that was just left. And they done a scan of my brain, and they said it was clear. Um, but everyone's scans are clear. Everyone's scans
well,
are
this is
clear
it
at the
because
minute.
we're not acknowledging the pathology. I keep saying we're not looking anymore. Doctors generally don't look at root cause analysis, particularly when it comes to this new pathology. It is a multi-systemic inflammatory condition. And it does a lot of things, for what, turning your body into a spike protein factory distributed around the entire body, turns you into a clotting machine. And we'll talk about that in a minute because you've got some stories to tell. Clotting, it affects your immune system. With that, it's your ability to fight infection. It's cancer screening that the body does naturally. It does things like autoimmunity. Obviously, if your human cell's not making a human protein, the body will attack it. And wherever this is distributed to, that's why people get these plethora of random symptoms because certain tissue beds are affected by this autoimmune inflammatory process. And then we've got this protein floating about the body that just doesn't. No, the body doesn't know how to deal with it. It's spike protein. It's never been in the human body. It has no biological function. How do we excrete it? So it hangs around, and the body's just what do we do with this? And they continue to produce it. So then if you don't acknowledge the problem, then you don't know the tests. For example, very early on, we had heart problems in young people, and people were having an ECG and an echo maybe at a push 12 months later and being told, your cardiac enzymes are fine. But that's not the test to rule in or out myocarditis. You need a gadolinium enhanced MRI. And they
Yeah,
weren't doing them. So if you don't look for something, you don't find it. So these MRIs that come back normal on everyone who's vaccine injured, it's not, unfortunately. I've seen people who've had MRIs that are frankly abnormal and they've been told they're normal. So that's
yeah.
a whole rabbit hole to go down as well.
Oh, yeah.
Dear me. So again, doing these cursory tests, they can't find anything. I mean, can you count on one hand how many tests you had? Were you sort of
I had MRI in my spine and brain. They done an abdomen CT scan. That came back with things on it, but nothing to worry about. And they sent me for an EMG test. My left leg has been completely numb from when this all started. But it's sort of gone up my leg further. So they sent me to Southampton for EMG results, and it came back as chronic nerve inflammation and denervation. I think it's nerves are not contacted in parts of my leg. They asked for an updated MRI of my back, and it got refused.
Well, again, this is where the sort of differential will be easily. It's very easy to put that on your spinal surgery and the consequences. And it may well be the parts of everything down south from where you had your operation may well be an element of, musculoskeletal orthopedic back problem, but it's all the rest of it. They can't pin
Yeah.
all of these drop attacks and fits. And we'll talk about clots actually, because I think you told me a story over dinner in Guernsey about pulling clots out of yourself. So when did you start getting issues with your blood?
So I was on well, what I thought was a lethal amount of medication. I was on about 21 medications, epilepsy medications. Even though I'd never been tested for epilepsy, they were just throwing everything down the corridor to see what could stop it. In the January, I decided I didn't want to take the medication anymore because it was screwing me up royal and proper. It was putting me into these seizures within about 4 minutes. I could take a gabapentin and I'd be on the floor convulsing for an hour, and I knew it was the tablet that was doing it. And then in March, I started to get clots in the back of my leg, on my left leg. My calf would then quite like swell up. My foot would go fairly blue. And the stinging, it's like someone ramming a dart in the back of your leg. It's so sharp. And yeah, I presented to hospital. My blood pressure at the time was 170 over 150. I
This all sounds like sciatica, Dan, I'm afraid. It's all
oh,
sciatica.
you as well.
I'm going to refer you to the local functional neuro centre. No, carry on. Sorry, I cut
Well,
you
that's
off.
what they did. They put me into 12 weeks of talking therapy while trying to pull clots out, well, trying to break clots up in my leg.
So
And yeah, I
this was
woke.
a confirmed DVT at this point.
No, this was advice and help that I'd got from other doctors and stuff. I didn't know what it was. I knew that I weren't right. My blood pressure, like I said, was through the roof. My heart rate was through the roof. I couldn't see. The chest pain was phenomenal. I couldn't breathe. It just felt like someone was strangling my heart. It was horrible. And I went to A&E and yeah, I was discharged within 8 minutes. They said the clot was an anxiety bruise and that I just had a bit of health anxiety. Um, and then yeah, I had to come home and ring a cardiologist. He said, "Yeah, I'm fairly certain that's a clot." And then yeah, I then decided to then start trying to look at natural blood thinners. I was also smashing a lot of aspirin. Um, and by the March, I woke up. I think it was about 3 o'clock in the morning. Something didn't feel right. And I could feel something. It was like a church bell in my nose. And I went into the bathroom and I could see it there. And I pulled it and I just thought, oh, it just might be a bit of bit snot. And it wasn't. As I've pulled it, there was a resistance there, and I've pulled it and pulled it and pulled it, and within it was about 3 inches in length. And I could feel it from up here that I was pulling from. My seizure activity from when I was pulling that out went from 100 a week down to about 30 a month. And I noticed all the head pressure had it was almost like it had burst a balloon for me. It was incredible. And then following that on, I had then another 5 suspected clots in the same leg.
No, they're anxiety bruising. I
Well,
mean,
just antidepressants.
I'm trying to get my head around this. I mean, literally, we talked earlier about excluding things actively. You're in A&E, you've got a leg swelling. The differential diagnosis is very, very narrow. But the one thing you have to do, a bit like if you're walking with chest pain, is rule out the heart attack. You do a
Mhm.
troponin, serial troponins, and you do other tests as well to look at other causes of differential. Here, you've got a unilateral leg swelling. Like the way you've described it, it's a DVT until proven otherwise. Whether you've got
Yeah.
venous thromboembolism, history, or risk factors, it doesn't matter. But you've got to rule it out, and you rule it out with a D dimer. Did they do that? They would give you a
No,
negative test for it.
D-dimers have been refused. I can't even get a blood test these days. They won't even take my blood.
So this physical swelling in your legs and tenderness and pain didn't do the blood test, let alone the scan, the Doppler ultrasound, and told you it was anxiety bruising, which I'll tell you now I've never heard in my career as a
Well,
doctor.
what
This is
was funny
what's
though,
written
it
on
was
that
two
slide.
weeks after that, I then got another message from someone who got the exact same diagnosis as me, an anxiety bruise for a clot in the same hospital.
I swear some days, Dan, I've missed a memo that's gone round, this is how we want to treat dissenters of COVID, gaslight them and tell them all mad. And then also anyone who suggests that there could be a vaccine injury, just tell them they're mad and they've got functional neurological disorder. I must have missed that memo because like it just seems like I'm outside of the inner circle of, I mean, what makes doctors firstly make such terrible clinical decisions and diagnosis to then, you've had to do all this yourself, Dan. Is that fair to say? I mean, are you
Yeah.
getting any acknowledgement from any Guernsey-based doctor, even on the
Nope.
sly?
Nope.
Ones even say
Nothing.
no, it could be no,
No help from anyone from anywhere.
and that's dangerous as well because that trust will never come back, will it? The way they've made you feel,
I
they've made
refuse
all the
now,
others.
David, to go into hospital. I refuse it. I've done my DNR. I've planned my funeral if it all goes to pot. And I won't go back in the hospital under any circumstances.
And I think this is what patients it's tragic to hear that doctors don't realise that they've got this massive growing group of people that are realising they did it for the right reason. They believed their doctor, they trusted the system, and they did it for the right reasons, as we mentioned earlier. So we didn't kill Granny, and we can get out of this horrible situation. And then you take it and get the consequences, and you just dropped. You just dropped and ignored and chastised, like most. This has gone on through history, hasn't it? When it comes to the V word, anyone who
Yeah.
suffers the consequences, just like anathema to the medical profession. And so you form groups in Guernsey, is that right? So you mentioned earlier, is everyone having similar experiences?
Yeah, the people that I've spoken to, I went sort of the other way and started speaking to people on a global scale because even with the FND diagnosis at that point, I still didn't really understand what was going on with me. I still didn't put it down to the jab. Because I was in the symptoms were such an array. I was fitting into MS, I was fitting into ALS, I was fitting into Parkinson's, everything. So I had to learn everything that I needed to know to understand what was going wrong with me, if that makes
Well,
sense.
this is what your neurologist should have been going through. These are the
Yeah,
scans that you should have been having, the scans to rule out those, because it does sound like ALS. It does sound like a blend between that and MS, and they're all neuroinflammatory conditions. They're all
yeah.
neurodegenerative issues. So why aren't they being? So you're looking at this yourself as a layperson. You were doing what you were doing before. It wasn't medical, and now you're suddenly having to sort of read in conspiracy theory circles and find out the facts of. So what was going on in terms of treatment? Were you supplementing yourself? Were you trying to manage conditions yourself? Because you're on a lot
Yeah.
of allopathic stuff. You mentioned 21 tablets. Did you start phasing them out?
I stopped them all in one day, which I don't recommend. It was disgusting. It was really horrible. It was, I saw things and it was just disgusting on every level. It was really not nice. But the more weeks that had went past, I could feel my body getting better. Um, and once I then started to get the medication out of me, a lot of the groups and stuff that I was speaking about, they were helping alongside Dan get on vitamin D and try some magnesium and to be honest, I was never clued up on supplements or anything like that previous. And I started on the vitamin D and fish oil first of all, and my sense of depression honestly went. It's what I call my happy hormone. Um, and then once I then got a grasp of what this was doing, I then started to explore further. And then I started on a spike detox last January, the McCulloch detox.
Did that come to you from a third party just saying, have you seen this? Try it.
Yeah,
So
it was through groups. There was obviously a lot of people. I don't know what I can mention on here, but obviously ivermectin, methylene blue. There is so many routes and pathways that you can go down for this, and it's very much whatever you throw at the wall and sticks, you go with. We're all so different. What might work for me might not work for someone else. So I know people that have done a detox and they've felt no different. But for me, it was very lucky. I turned my diet around, which was another huge thing. Um, and yeah, just started supplementing and doing detoxes and things like that. And I'm not cured by any means, but I've got a lot of better way of life now than I did.
But you're not getting this from your doctor, are you? This is the point. This is where the doctors, this is a new area of research, but sat in a room with them, they're all openly acknowledging it, but at the same time sticking their head right back in the sand. You shouldn't have there should be trials now on these detox protocols to say, objective measures, are the inflammatory markers coming down? Are the clotting markers, D-dimer coming down, etc.? Are the cardiac markers coming down? There are now they're mooting these new spike protein antibody tests at Discern. Is somebody still making spike protein antibodies to the mRNA induced subset? That should
Mhm.
be flying. That should be everyone's focus should be on it, but they don't want it to be that way. They want it to be over there. Look over there, the child trafficking. Look over there, the war. They don't want to look at the problem here. And that's a major problem in medical research. If the problem doesn't exist, then how do you find a solution? And here you are popping all these pills, and we don't really know the combinations. I mean, I always say that when I'm doing a consult on spike protein, I'm not an expert. I detox
No,
myself, because I'm a vaccinated anti-vaxxer, and it got me better. And you've mentioned today that you've had things that you've noticed instant responses to, others haven't, and I acknowledge that as well. People take 20 different things and they don't work for that person.
yeah,
So we don't know what we're dealing with, and we're all kind of like reading in the shadows of the conspiracy theory forums and trying these things and sort of blind leading the blind in a way. But people are getting benefits, and you're all banding together now. And the thing about Guernsey is it's a closed population, isn't it? It's an island population. So, are people talking about the kind of amount of funerals they're going to? Are people talking about the amount of, cancers that are going around on the island? Because I know when we came over for the conference, there was a hit piece written about it, and then somebody had responded. And I'll try and dig that piece out for this Substack actually. That they said
yeah.
you've seen upticks in lots of different parameters.
It's no one's noticing anything. There isn't any time that we engage with HSC or people like deputies and things. Are you seeing an uptake in deaths? No, deaths are still the same. Are you seeing more heart attacks? No. Any more strokes? No. Oh, okay. Well, if
That
you're not
doesn't bear
seeing,
out in the data, does it? That's the thing. That's what that hit piece was responded to with, saying these are the incidence rate changes from before the vaccine and after. And there are
yeah,
some considerably significant upticks, and I'll try and find that document for linking into this. But like you say, you're speaking to the medics, or the official line is, oh no, there's no extra funerals, there's no excess death, there's no heart attacks in young people. Yeah, we've been speaking to them, day in, day out, keep kids that have got heart issues after the vaccine. It's quite an
yeah.
unusual, unprecedented situation.
It's horrible. You do feel very alone because when you're going through this and you go, right, okay, well, I'm going to go to a doctor and they're going to be able to fix me. And they go, no, I can't fix you. Then you go to the hospital and they go, sorry, we can't help you. And then you're left, right, okay, well, what is my option? The only option realistically is to go private. If you're vaccine injured, that is the only option now. Um, and if you haven't got the money for that, it's unfortunately you're sat at home and you're put on the shelf. There isn't a lot out there for us. I've not spoken or had any help or support for the last 2 years. I just got told to go home and have a cup of tea and wait.
Just it's an utter bizarre
I'm
approach
having
to medicine. Medicine used to be, holistic. It used to be looking at the biopsychosocial approach to people. Look, are there any natural options? Let's give some informed consent for once in a while. It just everything seemed to go out the window in lockstep. I just wanted to use an example at this point. You said no doctors have openly spoken to you about this being a potential. One doctor, I think, was a little bit vocal in Guernsey, and I'm sure he won't mind me naming him, Scott
yeah,
Mitchell. He's had hell to pay, hasn't he? I mean, I don't know his current situation, but he's not in the country anymore. He's been
no.
kind of hounded out. What happened there? Do you know the backstory there? Because he was kind of high.
I
Yeah, he
think he
got.
stood up for the for lockdown measures and stuff. He wasn't for the lockdowns and things like that and vaccinating the children. So he stood up and put his opinion across to HSC, and the HSC didn't like it. And that was then Scott then had to resign. He lost his job and yeah, he had to leave the island, unfortunately. And also we've got a local cardiologist that's also being very badly persecuted. Um,
But
and
you can
I
count them literally on two fingers, can't you? Those two people. So Scott and Dean. Dean, I'm sure Dean won't mind me saying his name either. Dean Patterson. He's a
yeah,
guy. He's an absolute heart of gold. If you forgive the pun, he is a cardiologist. Just a great man, and I've seen him speak publicly. Just a warrior for just basic human rights for starters. We don't have to get too deep here. The human rights around masks and lockdowns, and not giving it to children and pregnant women. There was never a need, and so the trouble it's brought to those two careers. I don't know the formal situations, but they've had hell to pay. It's just not. It's an odd lockstep approach. All the UK doctors have been kicked out, including myself. We've
yeah.
been
Well, it's
not
a
not
religion,
quite.
isn't it?
Yeah, it's cultism, and to not be able to have ideas and opinions. I mean, my own criminal position being put on the criminal list is because I allowed my own ideas and opinions to overrule safeguarding policy. Hence, I should never be able to work with children again. Is the rule. So this is this weird kind of overreach, overstep of the government, just at the mere questioning, isn't it? Because all they were doing, those two doctors were saying, look. I'm a cardiologist. I live on an island and I'm seeing loads of myocarditis, more so than I've ever done in my career. That's Dean's story. Scott's seeing things in an ED, in urgent care, and he's seeing
Yeah,
upticks. If you're working in a closed environment, even if it's just a district general like me, and I'm seeing more young people coming with strokes, it's a warning sign, isn't it? It's a warning signal. That's what happened with me. I was seeing these odd presentations. Speak to my colleagues. Are you seeing this? No. Same thing you get when you're raising questions. Are you seeing increased funerals? No. No one wants to
yeah.
talk about it. It's such an unusual phenomenon.
Oh, it is. You're very well, as we put here, we're the lepers of Guernsey, because there's no one and no one wants to talk about it. No one, even to treat the symptoms that we're presenting with, they're still not treating them. We just left.
I think that's a good time to bring in really to finish really is the event we met first time
Yeah,
at an event. Do you want to talk about that because that's an event that's been growing slowly and then I think this year kind of took off. I was there. It was an incredible, experience. I say incredible. It was tragic. At one point we had all the people vaccine injured in the room standing up, and just a moment we had the vaccine injury panel where the stories were just horrendous to hear, and people were having the mic passed around telling their horrific stories. So tell us a tale of how that came to fruition, that event we went to, and what was a prelude to that, because they can't shut you up. That's the point.
no,
You can't shut
yeah.
you up.
Even though they're trying.
I'm surprised that event went
February,
ahead, to be honest. But yeah,
yeah. February last year, we set the group up. And yeah, I went out. I didn't realise what was going on behind the scenes previous in Guernsey. They'd done functions and conferences and stuff before. And I just stood up and I went, well, I'm going to go for this. I'm vaccine injured. Let's see who else is out there. So my first meeting was at Costa in town, and one person turned up. But it didn't defeat me in any way. The bloke was very happy. He was like, thank you for all the information. He was over the moon. And we kept doing coffee meets. And then a lovely woman called Jo Robinson. She's been an absolute anchor and she's been absolutely brilliant throughout this. She's always offered her help and support. And we carried on doing the meets and groups. And then we said, well, let's do another event. We got in contact with Laura. And Laura went, yeah, let's do it. Let's go for it. And then I think that was last July we started planning. And then in the February we managed to get it done, which was like you said, it was a lovely event. It was really nice for me. I've sat here on a screen talking to people. No one really wants to talk about it in real life. So to be in a room full of people that were like-minded or in the same similar situations to myself was quite powerful for me. It was, yeah, there was a lot there, and to be honest, I think we needed a week more than 2 days to get through everything.
Would have been nice actually. Yeah, it sort of ended the day too soon. It was all kind of packed in, wasn't it? You know, we were all there. We all saw these doctors. Firstly, the hit piece. You know, went to try and character assassinate them before they'd even spoke. God forbid some doctors from Guernsey actually might turn up and watch this and watch professors of oncology and epidemiologists speak. And you know, it's not like Peter McCulloch isn't, you know, one of the most decorated published guys in the world. I'd be interested, even if I was like saying all these crazy anti-vaxxers are meeting and I'd want to go and watch. There'd be
Yeah,
something in me intrigued to know. I don't know
yeah,
if any of those people were there. I didn't meet anyone that were sort of on the other side, for want of a better phrase. But it was a
yeah,
packed event, and what we were watching was evidence-based medicine being presented like the old days when I used to do grand round meetings as a junior, and we were seeing people, you know, giving evidence. They weren't just saying, "Oh, spike protein is this," and it gets dissolved with this. They were using the proper published journals, proper data, and anyone sat in the room would see that this wasn't a conspiratorial meeting of tin hat wearers and people with functional neuro disorder. This was an evidence-based group of people with real symptoms, real harm, and real doctors trying to help them in that position rather than just giving them gaslighting therapy, as I call it. But
yeah.
it was a great event. Did the venue have any issues? Do you know, were they? I
No,
mean, they've been really good, haven't they? From
they've
what?
been really good. They were absolutely amazing. They were phenomenal. And they've always been, to be honest, everyone across this journey has always been quite helpful. I've not really suffered too much abuse, not as bad as yourself. Um, but there's been instances that have been difficult, but overall the support has been overwhelming. It's been lovely. So many people, the community is stepping up. We're now talking about this a lot more. We're just hit with no's all the time from HSC, unfortunately. They're just not willing to move or budge or to even offer a hand or even support these people. I don't get why it's down to the community of Guernsey to support these people.
Well, at some point, obviously, the truth will out, and we've got this ever increasing group of people now in the middle. You've got the original kind of people that will keep getting jabbed until they drop down, or you've got the others that would absolutely never go near a vaccine centre. This group in the middle are realising that they're going to funerals a lot. You know, they're seeing these clusters of odd cancers, or their neighbour's got this weird set of conditions and has gone from healthy to disabled. And on the other side, they've got somebody else who's the same. And people are comparing notes now. And, you know, these idiots in charge, they can only hide it for so long.
Yeah.
It's like a murder, isn't it? The victim, you know, there are some unsolved murders, but mostly the murderer gets caught in the end. So, you know, these people will be held to account, and it's not going to look good on them. I'm just ashamed for my colleagues because not only, you know, we've talked about the obvious points, but what's going on in their minds at this point? It's 2026. I often wonder, you know, when they're getting up in the morning to do their shift today in the local Guernsey A&E, where are they? Where are they not? Why are they doing the job? What's the point? Why bother if you're
You,
just going to?
you're supposed to care for people, aren't you? But there is no care. There's nothing here. And I'm being completely honest, it's not just my situation. I'm an admin of a group. I've spoke to many people who are in the same situation as myself. We don't have any vaccine compensation scheme put in place. The HSC refused to put it in place. We got the FOI for the yellow card reports for Guernsey. We sent that to the HSC and they've basically just ignored it. We presented them with enough information now and enough character references from people that have been affected. There's enough of us that are willing to meet with these people and talk about our injuries and try and set up a plan and a support network. But it's literally, David, it's refusal after refusal after refusal.
And it's odd because these same people are not taking the jabs themselves anymore. I remember
No.
sitting in a similar sort of problem. We went to a place in Gibraltar. Again, it's a setting where there's a closed population, and yeah, I was sat with the public health director there. I won't name names, but I said, "Are you going to have any more jabs?" He said, "Absolutely no, not a chance." And he sat in front of a billboard saying, "Go and get jabbed if you're pregnant," and I pointed it to him, and he just kind of put his hands up like that. And I don't know how I didn't swing for him. But how
That's
can you say I'm not going to have it myself? And that's what, if I offered to go around Guernsey, all the primary care centres and take a COVID jab in, I bet no one would take it because they all know. But it's this whole like I said, this flat refusal. I can't get my head around. If they must be a bit upset themselves that they were duped into taking something that's likely harm them as well. If they actually look in the mirror and say, "Do you think this vaccine's been good or bad for me?" It's
Yeah,
just
but it's
difficult.
almost sort of like doctors' approach, especially here, rather than being empathetic about the situation, it's straight up anger. So you can walk into an appointment and you can say, right, okay, well, I've got this, this, and this. And then you say, well, I strongly believe that my symptoms are down to the COVID vaccine, and you will be shown the door. You will be asked to leave that surgery. Um, you're not, it's just not, it's the big pink unicorn in the room.
And it's that aggression, isn't it? Like I say, it's aside from the gaslighting at the end of the day, it's that aggression. It's like a red rag to a bull.
Yeah.
And I
Oh, it
can't
is.
understand that because, back in the day, I always compared medicine to being a detective. Like you're
Yeah.
solving the crime of what's causing this set of symptoms, and you eliminate, people from your inquiries/diagnoses. But these people have got this massive elephant in the room that is a lot of people saying the same thing over it, and they must see it day in day out. If you're going in and saying, "I think it's vaccine injury," they must have three or four or five, and that's how it started with me. I'd have
Yeah.
three or four people in a 30-patient surgery saying, "Doc, I ain't been right since that jab." And if you keep
Yeah.
hearing it day in day out, then you don't stick your head in the sand. You say, "Well, there's a problem here," so I did, and here we are
Yeah.
today, defrocked, as it were.
Raise your head above the parapet, but you're on the right side of history, as I tell all the doctors that do this, like yourself, David. It is difficult, especially for yourself and others, but we know what we're doing is for the good of humanity, basically. We're just trying to be there and get the truth out and for people, for myself, to make people not want to do the same stupid thing that I've done.
And there's no
Or to
secondary
get to the
gain here, is it?
realization.
There's no
Hmm?
secondary gain. There's no secondary gain here. You've lost your livelihood. I mean, where are you now? Are you able to work at the moment?
They've actually, a recent appointment with the states, they're actually forcing me back to work in 20 days. I've been on disability now just a little under 3 years. And yeah, they're stopping all my benefits and things, and they've said that I've got to go back to work now.
And that's because they're sticking with this FND.
Yeah, it's a psychological illness that they can't find anything wrong with me. But I've got folders of evidence that states otherwise, but they refuse to see it.
What are your plans? What are you going to do?
I
What
don't know. I don't know. I literally do not know at the minute. I'm being persecuted heavily by the states of Guernsey and by HSC from what I've been saying, and I've not been aggressive. I've not been horrible. I've just been wanting to get this out there so that we can have support networks and pathways set up for people that are suffering. People shouldn't be sat at home having strokes or heart attacks or having to ring a cardiologist in the UK to get a blood clot out their leg. They should be doing this, but instead we're having to do this.
I think that was the last question, and you pretty much answered it before I've asked it. If you were to sit in front of a panel of is it HSE or HSC? CSC,
HSC,
HSC. What would you say to them? I think you've answered it, but yeah, just to finish, what would you do? What would you be saying to these people?
stop ignoring us. Just treat what you can see and test for what there could be. Because none of us are getting tested. None of us are, we're just literally just, right, state insane, put on the shelf. That's it. But a lot of us, like, there's people with kids that they should be running around every summer with their children and enjoying family activities or going away on holiday, but they're not. They're sat in bed and they can't move.
Hmm.
It's not on. But they're refusing to see how the vaccine injured have to live. This is the most annoying part of the situation is they're not willing to meet us to see what we have to go through. So if you're not willing to be prepared to see what we have to go through, I can't see any changes being made within Guernsey, David. I can't.
just a crazy, abhorrent situation. So you've got these sort of two systems now. They've got their heads in the sand, and you guys are just trying to get healthy again, get
Yeah,
healthy and functional. Like, is it you're how old now? 37, did you say?
36. Yeah.
36 years of age, and you've got, you're at your peak, and you shouldn't be having to worry about this and symptoms and the stress this must have caused you just off the scale. I can't imagine.
I thought I was going to die. I
Mm.
generally did think I was going to die. Everyone did. Um, so to see where I am now, it's definitely an improvement of what I was. I'm not, like I said, I'm not cured by any means. There's a lot of problems we've still got, but the way of life I've got now is more than what I had before, and I'll take what I've got now.
Yeah. It's an amazing attitude, Dan, and thank you ever so much for talking about it. Everything you do, you're sort of the linchpin with Laura and others, a small team that have grown. Awareness keep it can only get bigger, can't it? It can't get smaller as
Yeah,
people convene and events that we went to together. That's going to start conversations, and that's what we need to start conversations. At the coffee rooms, as it all started, Costa
yeah,
Coffee conversation. Somebody might hear that. We had it even in Guernsey in the spa. We were having conversations between ourselves. People were hearing in and chipping in. Some ran away, but other people, this is how it grows, isn't it? Like a wildfire, and they can't stop a wildfire when it takes hold. So let's hope for a wildfire of truth in Guernsey, not a literal fire. Don't shut my channel down for asking for. Dan, thank you. Any last words? Any last
No,
words?
thank you very much, David. And thank you for everything you do as well. I know it's very difficult for you, and it's affected you and your family and everything else, but we're all doing this for the right reasons. Believe us, we get nothing out of this for speaking out, and the reason we do it is because we care.
Ditto. That's why we've all lost everything, for speaking out. And, I don't really think it's an extra special gift that I have. I've just got, patient-centered care, like I signed up to, the Hippocratic Oath to do no harm. Nothing special about that. It just seems to have fled the minds and the souls of the rest of the profession.
Mm,
So
yeah,
thank you for your thanks as well. And long may the growth of the truth in, I need to Gibraltar then, Guernsey continue. Take care,
yeah.
Dan. Stay in touch. Let me know how you're getting on.
Thank you, David. Cheers.
Take care.